little bit of how you would, if you wanted to begin with us, I can tell you that. The new patient department, that's myself and 4 other women, you would just give us a call. And you can call us if you have questions. Maybe you're not ready to book an appointment. Maybe you'd like more information than what is in this packet. We're happy to send out more information. If you were to want to go a step further, we offer a half-hour telephone consultation with a physician. There is no charge for that. So if you want just the opportunity to talk with one of our doctors about what your plans are, what you'd like to do, get a feel for the practice, you can do that at any time. The 1-hour in-person consult that establishes you as a patient, which would include your physical exam and screening so that you could move forward, the fee for that is $375. But you don't need to do that to begin with. If you want to begin with just talking to the doctor, then the next step would be that you would have a conversation with Peggy, who's our in-house counselor, who just talks with you about potential issues that could arise with using a surrogate, with using a donor, with the community at large. She has a conversation with all of our patients who are considering undergoing third-party assisted reproductive technologies. There's no charge for that. After speaking with Peggy, you have the opportunity to speak with your clinical coordinator. So let me explain. We have 6 physicians. Each of our physicians has a patient care team. That means they have a new patient coordinator, a nurse, a medical assistant, and a coordinator, a clinical coordinator who works with that doctor. So even though we have 6 physicians, there is one team that will be your team. In addition, we put another layer of organization on it, and each of those teams, there are 6 teams and there are 3 dyads. So 2 doctors' teams are grouped together. So if your doctor's not available, you would see the team, the dyad, the other doctor on that team, or the other nurse on that team. So there's a smaller group that will always be following you. In addition, we have lab meeting. Every Thursday afternoon, all 6 of our physicians get together. They do what I would call peer review, or also familiarity with cases, so that at that point in time, you have all the doctors focus on your particular treatment cycle. And that gives you really over 100 years of experience if you were to count up all of our doctors, years that they've been in this field. It also allows all the doctors to become familiar with you, with your situation, so that if it should be a weekend and there's coverage for one of the other doctors, they all know who you are. They've been introduced by their colleagues. So to get back to your clinical coordinator, after you speak with Peggy, you can have a conversation with your clinical coordinator. Now, at this point in time, you don't need to have chosen a surrogate. You don't need to have a donor. You don't need to really have anything in place yet. But if you want to talk to someone about how would this work? What's my next step? What would be the steps that I would go through, to get where I want to go? That's what the clinical coordinator is there for. The new patient coordinators, we can help you too. I mean, we know overall the steps, but you will have your own clinical coordinator that you can talk to at any time. You're also able to speak with a financial coordinator who can give you a better idea of what you're, looking at in terms of fees for what you've planned. We have a donor agency that's associated with Pacific Fertility Center. Our donors are for our patients only, but we work with patients who bring donors from other agencies or patients who have known donors. So that works fine. We also have a frozen donor egg bank. And we have that's the first, we're the first Northern California donor egg bank. We opened it over a year ago. So if you want a less expensive way to move through this treatment, and you want to select donor eggs and not have to worry about getting a donor up and timed and all of that can happen with a donor, you have that opportunity as well. You also have the possibility, if you find a donor but you don't have a carrier and you want to go ahead and create your embryos and cryopreserve them, you can do that. And they can just be over here waiting for when you do find your carrier. So that's another opportunity as well. We use that fast freeze method, vitrification, that really does preserve vitality of those embryos. It's an amazing technology. And again, our clinic was one of the first ones in the Bay Area to really embrace and use it. So our embryologists have been experienced with vitrification for over 5 years. They've been working with it. What else? Any questions? Yes?
For your frozen eggs, what are your guidelines as far as how many children could be born from a particular egg?
That's a very good question.
Donor.
Right. We will warm enough eggs to create two, what is the term that they use here? Chromosomally correct or viable embryos. So in other words, these are embryos that the physicians and the embryologists say are good and look good. Now, when we warm those eggs, we don't just warm 2 eggs, because human fertilization is rather inefficient, believe it or not. But we'll warm a group, maybe 6. And if you get 3, you might get 3 embryos out of that, you might get 4. We guarantee 2. But if there's more created, they're yours.
Okay, my question was more revolving how many children do you allow to be born from the same egg donor?
Oh, well, that's a very good question. There are guidelines from the American Society of Reproductive Medicine that a donor in a certain geographic area only be allowed to donate, I think it's 6 times. And that's a guideline. So there are many donors out there who may move from one clinic to another, and there's no law anywhere that they have to register, or that one clinic they've gone to, in Oakland, and then they come to San Francisco, they could be donating more time. So there's not the way that there's no legal legislated. There's only guidelines from the American Society of Reproductive Medicine, which our physicians follow.
I'm just thinking, I mean, it's kind of a tangent, but I'm just thinking of 2 examples where it's completely the reverse side of things, where one man apparently he used his sperm for multiple families, over 30 children or something.
He was a sperm donor?
Yes, and then there was a couple in England who, when the process of getting engaged, then he found out that they were actually brother and sister through artificial insemination.
Well, I mean, I think that's part of the Pandora's box that assisted reproductive technology is open, and I don't know that there is any guarantee about that. I mean, I think that's why the governing board of, all reproductive endocrinologists has guidelines. But no, you're right. There's no guarantee. Any other questions? Yes.
Do you guys have insurance, or if they mix the eggs or the embryos? Let's say
if there's a problem,
right,
if there's a mix-up.
Exactly.
We do not have that insurance that I am aware of. I mean, if that were ever to happen, it would be discovered before any embryos were transferred, and they would be destroyed. And I'm sure the physicians would offer another cycle. But that has never happened. And one of the reasons that hasn't happened, I think, is that, one, we have a full-time laboratory staff. So we don't group our cycles and then put a group of patients through the lab and bring in lab staff to just cover that. And then the lab stuff's on and goes to other clinics. So where there have been mix-ups, it's been in that kind of clinic situation where you don't have an embryologist who works there all the time, every day. The other mix-ups that have occurred have been when there's only one embryologist in the lab. Part of our protocol is that no embryologist can handle any tissue unless there's a second one there. So one handles the tissue, the other checks off, yes, this is Mr. Jones' sperm, this is, you know, donor 126's eggs. So there's a double check there all the time. Plus, we have multiple, we actually have patented our whole system of how we track all of that. So it's, it's color coded, it's number coded, it's name coded. 2 embryologists have to be there. And we have a full-time staff that has worked together all the time. So it's a very smooth running machine.
Is it possible to bring frozen eggs from outside US, or that only they shouldn't?
The problem with bringing frozen eggs from outside the U.S. is the FDA. So whenever tissue is being taken from one person's body and put in another person's body, the federal government becomes involved, and it's not really possible, given those guidelines, to bring in tissue from outside. We have donor agencies, actually, that we have worked with over the years. These physicians actually purchased this practice in '99, November of '99. They had all come from UCSF. They were doctors at UCSF there previously, and also in private practice. So we've had a donor agency since '99, and we have worked with many agencies. And so our list, although it may not list all the donor agencies or all the carrier agencies that are available, it does list the ones that we have worked with and feel comfortable with. So your coordinator will help you and direct you. Because I know that it can be kind of daunting. So it's like, where do you begin with all of this? And that's why, the way that PFC is organized is to provide that for you every step of the way. From that very first conversation with maybe one of the new patient coordinators to your first conversation with a doctor, just to tell them what you're thinking about and what you'd like to do. We do definitely do work with you. Yes.
What is your success rate with the implementations to full delivery?
The success rates, you would be looking at the success rates of donor eggs, correct?
Yes.
Right, because the success rates are divided according to how we report them to the CDC, and they're age-related. And so within the donor guidelines, I think it's at about 70 to 80%. And part of, I will tell you, part of the way that we do statistics is from the cohort of eggs that were from that one treatment cycle, right? Out of that group of eggs and fertilization that happened, what percentage chance is that you are going to have a take-home baby? That's called cumulative results, and it's not just per transfer, because our doctors really are very involved with one healthy baby at a time. They do not they have worked very, very hard to perfect the single embryo transfer. That's why we offer comprehensive chromosome screening as a possibility as well, so that that embryo that's being transferred has all the chromosomes that it's supposed to have, not any less and not any more. But that is kind of our byline at Pacific Fertility Center, is one healthy baby at a time.
So, I'm sorry, did you say that?
I have 1 minute.
Oh, okay. So did you say that success was counted to pregnancy or to full delivery?
Delivery.
Okay.
And so, is PFC against twin double implantation
Not
of two embryos?
against, but the doctors will talk to you about it. I mean, there are healthy twins that are born all the time. There are also twin pregnancies that are difficult, and they're, you know, babies in the neonatal intensive care unit for longer than they really should be, and they have delayed, you know, maturation because of that. And I mean, there are issues. Would they absolutely say no? No, they would not, if you wanted to transfer to them. If, a lot, it has to do with the carrier though, because you guys are going to be using carriers. So your carrier has to agree that there's a possibility that she's going to be pregnant.
And where's the center?
We're in San Francisco. We're
Oh.
down along the Embarcadero
Perfect.
near Bay Street. We have attached garage, so unheard of in San Francisco. You can drive all the way up and park, and even if the garage is full, they will valet your car. So for our patients, there's always a parking